Monday's deadly stabbing at that Killeen Middle School has many parents concerned for their child's safety and their mental well-being.
6 News reporter Sydney Walker spoke with local mental health experts and learned how parents can support their children during this difficult time. Sydney?
When children experience trauma, especially in a place that they consider safe, like a school, their behavior and overall mental health can be greatly affected.
Violence of any kind, whether seen or in the environment of, can drastically affect children and teenagers alike.
The tragedy at Killeen ISD has many parents concerned about their child's exposure to a traumatic event, especially since it occurred at a place they were taught was safe.
Children are inside an environment of structure at school, and generally they've been taught this is a safe environment for you to be in, and now that's been disrupted.
Noah Tyner, a licensed professional counselor associate, says some symptoms won't begin to show for 3 to 6 months. Behavioral changes such as nightmares, bedwetting, or trouble self-regulating emotions can all occur when a child is exposed to trauma. Child life specialist Taylor Grace Freiberg says a change in a child's behavior can also be a sign that they need help.
Kids will show us that they need help through their behaviors, or they'll show us how they're coping through their behaviors.
Freiberg emphasizes that these changes shouldn't be ignored, and having an open and honest conversation about a tragedy with your child can help them.
When we leave kids in the dark, that gives them the opportunity to create a story on their own, and sometimes those stories are far worse than anything that actually took place.
For parents wondering how to start these difficult conversations, the experts recommend keeping it simple.
We're not trying to use fancy language. We're not trying to feel like we know the topic or what they're feeling.
Both experts emphasize that professional help is always available for families struggling to process these traumatic events, whether through school counselors or private therapists.
Look, more help is never a bad thing.
Tyner encourages parents to follow what he calls the 6 S's. Provide safety and security at home, engage in simple and straightforward conversations, supervise your children, maintain structure, encourage social support, and practice self-care.
All very good information. Sydney, thank you so much.